I'm sure you agree with me when you feel that the last 4 months has been hectic. Dealing with COVID-19 as a patient must be very difficult, because dealing with it as a doctor and running a medical centre is one of the most difficult things we've ever had to do. Luckily, we have great resources and good staff. And we're now sure that we're in a position where we can manage all the health-related concerns of our patients, regardless of their condition, and we are set up to be able to do this in the long term. You'll notice there's been changes to the way we provide services to our patients, right from your first phone call, where you'll be asked questions about do you have a fever, or do you have any symptoms suggestive of an infectious disease, down to when you arrive, you'll be given the option to stay in the car and wait until your doctor is available for your appointment, and also when you arrive in the surgery, we have changed the configuration, so the spacing between all the seats. The reception areas have screens now to protect you from them and them from any potentially at-risk patients. Unfortunately, we have had to remove all the reading material from the waiting room as an attempt to minimise the risk of contamination from patients. So remember to bring your phone or your iPad or something to read if you still like to read hard copy. One of the big changes we've made is set up facilities so that we can do remote appointments. So you can have a telephone appointment, and shortly you'll be able to have a video appointment if you feel that it's something that can be managed without face-to-face contact with the doctor, or you just feel anxious about travelling to the city. We now have a full complement of doctors, including 3 registrars in their final year of training. These doctors have got a lot of experience from the hospitals and from the work they've already done so far. One of them is my son, so feel free to see him as an alternative to seeing me. My regular patients already know that I had throat cancer in 2013-14. And I'm very pleased to report that I've had all my final checks and be given the big tick of approval, and I'm fully cleared from that. More recently, I've had a shoulder reconstruction, and I'm still in the recovery phase from that. I'm 12 weeks out from surgery now, and it is going according to plan. It's much slower than the recovery from the other shoulder I had done 12 years ago. My wife likes to put that down to age, but I just think it's had an extra 12 years to get worn out, so there's more to heal. My daughter has decided that we need a new puppy after our 2 dogs died a couple of years ago at 16 and 17 years of age. And it's lovely to have a new puppy in the house, although it is pretty exhausting. So we've had a couple of nights now with the puppy at home, so we're all looking a bit worse for wear. But the puppy is gorgeous. We're enjoying the puppy's company, and I'm sure Monty will settle in just fine. We're going to be doing regular updates. So if there's anything that you are specifically interested in or would like us to provide some feedback on, then feel free to give us some feedback, and we will attempt to address areas that you find most interesting.